When medicine was guesswork in the Middle Ages, getting sick was not just dangerous, it was confusing, humiliating, and often fatal in ways that made very little sense. Medicine was not built on experiments or biology. It was built on fear, tradition, religion, and a desperate need to feel like someone was in control. Doctors did not cure diseases. They interpreted them. Illness was believed to come from imbalance. Not bacteria, not viruses, not infection. Imbalance the human body, according to medieval medicine, was governed by 4 invisible substances called humours: blood, phlegm, black bile, and yellow bile. Health meant these humours were perfectly balanced. Sickness meant one of them had gone rogue. If you were too energetic, too warm, or too cheerful, you had too much blood. If you were slow, pale, or depressed, phlegm was blamed. Anger, fever, and restlessness meant excess yellow bile. Sadness, anxiety, or strange behavior meant black bile had taken over. Every symptom, no matter how severe or mild, was forced into this framework. Doctors did not ask what caused your illness. They asked what kind of person you were. Treatment followed logic that felt reasonable at the time. If your body was too hot, it needed cooling. If it was too wet, it needed drying. If you had too much blood, the solution was obvious: remove it. Bloodletting was the most common medical procedure in medieval Europe. It was used for headaches, fevers, infections, insomnia, anxiety, and even minor aches. A doctor would cut a vein or apply leeches and let the blood flow until he believed balance had been restored. Sometimes patients felt temporarily better, mostly because blood loss makes people weak, dizzy, and calm. Doctors interpreted this as success. Leeches became medical celebrities. Different parts of the body were believed to connect to different organs, so blood was drained from very specific locations. If you had a headache, blood might be taken from behind the ears. If you had stomach pain, a vein in the arm or leg would be chosen. Charts existed to tell doctors exactly where to cut for each illness. There were days considered ideal for bloodletting and days considered deadly. Astrology played a role. If the moon was in the wrong position, bleeding a patient could kill them. If the stars aligned properly, it might save their life. The patient's fate depended as much on the sky as on their symptoms. Medieval doctors did not wash their hands. They reused instruments. They wore the same robes from patient to patient. Infection was not understood. Pus was often seen as a good sign, proof that the body was expelling bad humors. When bloodletting failed, stronger remedies were introduced. One popular cure was purging. If illness came from something bad inside you, then forcing it out made sense. Patients were given powerful laxatives or emetics to induce violent diarrhea or vomiting. Herbs, minerals, and animal products were mixed into foul-tasting potions designed to empty the body completely. Suffering was expected. Pain meant the treatment was working. Doctors believed that the body could be bullied into health. Surgery existed, but it was crude and terrifying. Surgeons were often barbers, not physicians. The same man who shaved your beard might amputate your leg. Anesthesia did not exist. Alcohol was sometimes used, but many patients were simply held down. Wounds were cauterized with hot irons. Infections were treated by cutting away flesh until something changed. Survival was a matter of luck, strength, and whether the patient bled out before the procedure ended. Internal medicine was even stranger. Medieval doctors believed the brain produced mucus, which drained into the body. Too much mucus caused illness. This led to treatments involving sneezing powders designed to expel excess brain fluid through the nose. Patients were forced to inhale ground pepper or other irritants until they've sneezed uncontrollably. If that failed, stronger methods were used. Mental illness was especially misunderstood. Depression, anxiety, hallucinations, and seizures were often blamed on demonic influence. Treatments involved prayer, fasting, holy water, relics, and sometimes exorcism. A person experiencing a panic attack might be restrained, bled, purged, and prayed over in the same day. Women faced even harsher treatment. Many medieval doctors believed the uterus could wander through the body, causing hysteria. Symptoms included mood swings, fainting, nervousness, and insomnia. The cure involved strong smells. Pleasant scents were applied near the genitals to lure the uterus back into place. Foul odors were held near the nose to drive it downward. This was considered serious medical science. Childbirth was one of the most dangerous events in medieval life. Doctors often avoided it entirely, leaving it to midwives. When complications arose, remedies ranged from herbal mixtures to prayer to physical manipulation that often caused fatal injuries. If a baby was stillborn, blame was placed on the mother's behavior, emotions, or sins. Medicine and morality were inseparable. Pain relief barely existed. Opium was known but rarely used correctly. Alcohol dulled pain but also increased bleeding. Most patients endured procedures fully conscious, screaming, praying, or passing out. Death was common. Doctors expected it. Failure did not discredit medicine and reinforced it. If a patient died, it was because the illness was too strong, the humors too imbalanced, or God's will too absolute. The treatment was never questioned, only the timing or intensity. Despite all this, medieval people trusted doctors. Doing something felt better than doing nothing. Ritual mattered. Authority mattered. A man in robes speaking Latin inspired confidence, even if his cures were slowly killing you. Medicine was not about evidence. It was about order in a world where disease felt random and cruel. And this was only the beginning. Medicine without mercy. Medieval medicine did not begin in quiet libraries or careful observation. It began in fear. Disease was not understood as a biological process but as a moral event, a punishment, a curse, or an imbalance of invisible forces that no one could see and very few could explain. When a person fell ill, the first question was not, what caused this, but who offended God, or which forces turned against us. Doctors, if they could be called that, worked in a world where anatomy was barely studied and experimentation was dangerous, both socially and spiritually. Cutting open a human body was frowned upon, sometimes outright forbidden. As a result, medieval healers relied on ancient texts, superstition, astrology, and guesswork. The human body was seen as a fragile container filled with fluids that constantly threatened to spill into chaos. At the center of medieval medical belief was the theory of the four humors. According to this idea, inherited from ancient Greek scholars like Hippocrates and Galen, the body was governed by IV fluids: blood, phlegm, black bile, and yellow bile. Health existed only when these humors were perfectly balanced. Illness meant imbalance. Pain meant excess. Death meant complete disorder. Blood was associated with air and spring, phlegm with water and winter, black bile with earth and autumn, yellow bile with fire and summer. Every emotion, behavior, and physical symptom could be blamed on one of these fluids. Sadness meant too much black bile. Anger meant excess yellow bile. Laziness meant phlegm. Optimism meant blood. The cure, therefore, was not to treat the disease itself, but to remove whatever humor was believed to be overflowing. This logic justified some of the most disturbing medical practices in history. Bloodletting was the most common and respected treatment. It was prescribed for fevers, headaches, infections, insanity, bad dreams, and sometimes simply because the calendar said it was a good day to bleed. Doctors would cut open veins with knives or use leeches to drain blood slowly and painfully. The goal was not precision but volume. More blood removed meant more illness leaving the body. Patients were bled until they fainted, turned pale, or collapsed. These reactions were often taken as signs of success. If the patient survived, the treatment was praised. If the patient died, the illness was blamed for being too strong, never the cure. Leeches were considered especially refined tools. They were applied to sensitive areas like the gums, behind the ears, or even inside the mouth. Some patients were covered with dozens at a time. Medieval texts described exactly how many leeches should be used depending on age, gender, and social status. Nobles received careful leeching. Peasants were often simply cut. Bleeding was sometimes scheduled according to astrology. Doctors believed the stars influenced which parts of the body was safe to cut on specific days. A vein that was safe to open on Monday might be fatal to touch on Thursday. Charts were drawn linking zodiac signs to body parts. Eris ruled the head. Taurus governed the neck. Pisces controlled the feet. Bleeding the wrong area at the wrong time was believed to anger the cosmos itself. But bloodletting was only the beginning. When illness involved pain or swelling, medieval doctors often turned to purging. Vomiting, diarrhea, and sweating were encouraged as ways to force bad humors out. Patients were given toxic mixtures designed to make them violently sick. ERBs like hellebore were used despite being dangerously poisonous. The logic was simple. If the body was suffering, the medicine must be working. In some cases, patients were forced to drink substances that modern science would classify as lethal. Mercury was a popular cure for skin diseases and sexually transmitted infections. It caused mouth ulcers, hair loss, organ failure, and insanity, but it was believed to cleanse the body of corruption. When patients began drooling uncontrollably, doctors claimed the poison was drawing sickness out through the saliva. Urine was another diagnostic obsession. Medieval doctors believed urine revealed everything about a person's health. They studied its color, smell, thickness, and even taste. A pale urine meant weakness. Dark urine meant fever. Foamy urine meant kidney problems. Doctors carried urine flasks as symbols of their profession, holding them up to the light like sacred objects. Treatment decisions were often made without ever seeing the patient. A family member would bring a jar of urine to the doctor, who would examine it carefully and prescribe a cure without asking further questions. This practice was so common that satirical art from the period frequently mocked doctors staring at flasks while ignoring dying patients nearby. Surgery, when it occurred, was brutal and primitive. Without anesthesia, even minor procedures were torture. Amputations were performed with saws. Infections were cauterized with red-hot irons. Wounds were packed with herbs, animal fat, or even manure under the belief that organic matter promoted healing. Pain relief was limited to alcohol, opium, or prayers. Screaming was expected. Fainting was considered helpful. If a patient survived surgery, it was considered a miracle. If they didn't, it was considered fate. Many cures involved animals, not as medicine but as magical tools. Live chickens were strapped to plague sores to draw out illness. Toads were tied to limbs to absorb disease. Snakes were dried, crushed, and mixed into potions. The logic was symbolic rather than scientific. If an animal was associated with decay, it might attract sickness away from the body. Religion and medicine were inseparable. Illness was often treated as spiritual failure. Pilgrimages were prescribed alongside potions. Relics were pressed against wounds. Holy water was consumed like medicine. Saints were invoked for specific diseases. Saint Apollonia for toothaches, Saint Roch for plague, Saint Vitus for seizures. Doctors existed alongside barber surgeons, monks, midwives, and folk healers. Each offered different cures, often contradicting one another. A patient might be bled by a doctor in the morning, given herbs by a monk in the afternoon, and subjected to a magical charm by a village healer at night. Survival depended less on treatment and more on luck. What made medieval cures truly dangerous was not just their brutality but the confidence behind them. Doctors believed deeply in what they were doing. Ancient texts were treated as unquestionable truths. If a cure had been written centuries earlier, it was considered proven, regardless of its results. Progress was slow because failure was rarely acknowledged. When a patient died, the explanation was always the same. The illness was too powerful, the stars were unfavorable, or the patient waited too long. The idea that the treatment itself might be harmful was almost unthinkable. In this world, pain was normal, suffering was expected, and medicine often shortened lives instead of saving them. Yet these strange cures laid the foundation for future understanding. Each failure quietly taught lessons, even if no one recognized them at the time. Medieval doctors did not heal in the modern sense. They battled sickness with fear, tradition, and ritual, and in doing so, they created some of the weirdest, most terrifying cures humanity has ever accepted as care. Faith, fear, and folk magic in medieval medicine. Medieval medicine did not exist in isolation from religion or superstition. In fact, for most people living in the Middle Ages, illness was not primarily a physical problem, it was a spiritual event. Disease was seen as a message from God, a punishment for sin, a test of faith, or sometimes the work of demons, witches, or malevolent spirits. Because of this worldview, medical treatment was rarely limited to yabs or physical interventions. It almost always included prayer, ritual, and fear-driven folk magic. Doctors, monks, barber surgeons, and village healers all operated within this belief system. Even the most educated physicians, trained in universities like Salerno or Bowani, believed that God ultimately controlled health and sickness. A cure that ignored divine forces was considered incomplete or even dangerous. Prayer was often the first prescription. Patients were instructed to confess their sins before treatment, because an unconfessed soul might block the effectiveness of any cure. Doctors recommended specific prayers for specific illnesses. Toothaches, fevers, epilepsy, and childbirth complications each had associated saints believed to specialize in those conditions. Saint Apollonia was invoked for tooth pain, Saint Vitus for seizures, Saint Margaret for childbirth. Faith was not optional. It was medicine. Relics were considered powerful healing tools. Pieces of saints' bones, scraps of clothing, dried blood, or dust from tombs were carried, worn, or placed directly on the body. Some doctors instructed patients to dissolve relic dust in water and drink it. Others recommended sleeping with a saintess bone under the pillow to cure night terrors or chronic pain. The more famous the saint, the stronger the cure was believed to be. Pilgrimages were another medical prescription. If local remedies failed, a patient might be told to travel hundreds of miles to a shrine known for miracles. The journey itself was exhausting and dangerous, but suffering was seen as part of the cure. If the patient recovered, it proved divine mercy. If they died, it proved divine will. Either outcome confirmed the belief system. Alongside religion existed folk magic, passed down orally through generations. These practices blended pre-Christian traditions with medieval Christianity. Amulets were extremely common. They could be made from animal teeth, stones, herbs, written charms, or bits of metal engraved with symbols. Many contained Latin prayers that neither the healer nor the patient could read, which only made them seem more powerful. Written charms were especially popular. Doctors and healers wrote words on parchment, folded it, and tied it to the body with string. Some charms had to be written at specific times of day or phases of the moon. Others required silence during writing, because speaking might weaken the magic. A charm written incorrectly could supposedly worsen the illness. The spoken spells were also used. Healers whispered words over wounds, burns, or fevers. Some spells were meant to command the illness to leave the body. Others threatened the disease with divine punishment if it did not obey. The tone was often aggressive, reflecting the belief that sickness was an invading force rather than a natural process. Astrology played a major role in medieval cures. Doctors believed that the human body was directly connected to the stars and planets. Each zodiac sign ruled a specific body part. Aries governed the head, Taurus the neck, Leo the heart. Cutting, bleeding, or treating a body part while its ruling sign was ascendant was considered extremely dangerous. Because of this, medical calendars were common. These charts told doctors when it was safe to perform bloodletting, surgery, or even administer medicine. A perfectly good treatment could be delayed for weeks because the stars were not aligned. Patients sometimes died waiting for a favorable planetary position. Eclipses were especially feared. If someone fell ill during an eclipse, it was considered a very bad sign. Some doctors refused to treat patients during eclipses at all, believing any intervention would fail or anger cosmic forces. Fear of witchcraft also shaped medieval medicine. If an illness did not respond to standard treatments, suspicion often fell on curses. Sudden paralysis, unexplained pain, infertility, or madness were frequently blamed on witchcraft. Doctors might recommend counterspells, protective charms, or even accusations against supposed witch. In some cases, healing involved deliberately transferring the illness to another object. A common belief held that disease could be moved out of the body and into an animal, a tree, or even another person. Patients were told to touch a sick body part to a tree at dawn, whispering the illness into the bark. The tree would then hold the disease. Animals were sometimes sacrificed symbolically. A patient with fever might be told to pass bread touched to their body to a dog or pig. When the animal ate it, the illness was believed to leave the patient and enter the animal instead. If the animal later became sick, this was seen as proof the cure worked. None of these practices were fringe beliefs. They were mainstream medicine for centuries. Doctors wrote about them in serious medical texts. Universities taught astrology alongside anatomy. Churches supported relic healing. Folk magic filled the gaps where official medicine failed. To a medieval person, these cures were logical. In a world without germs, antibiotics, or understanding of internal organs, illness needed an explanation. Faith, fear, and tradition provided one. The body was not just flesh and blood. It was a battlefield between divine will, cosmic forces, and unseen enemies. And in that world, medicine was not about understanding disease. It was about negotiating with it. Blood, balance, and blind faith in the medieval world. Illness was not simply something that happened to the body. It was something that revealed a deeper imbalance in the universe itself. Disease was thought to be the result of disrupted harmony between the body, the soul, the environment, and God. Doctors did not ask what caused an illness in the modern sense. Instead, they asked what had gone out of balance. And once that imbalance was identified, the cure often involved methods that now seem terrifying, absurd, or cruel. At the center of medieval medicine was the theory of the four humors. According to ancient Greek teachings adopted by medieval Europe, the human body was governed by four fluids: blood, phlegm, yellow bile, and black bile. Health depended on keeping these humors in perfect balance. Too much blood made a person hot and excitable. Too much phlegm caused sluggishness. Excess yellow bile produced anger, while black bile led to sadness and melancholy. Every symptom, from a fever to a bad mood, was explained through this framework. Because of this belief, one of the most common medieval cures for almost any condition was bloodletting. If a patient had a fever, headache, infection, or even emotional distress, doctors often concluded that the body had too much blood. The solution was simple and horrifying: remove it. Bloodletting was performed using knives, sharp lancets, or leeches. The goal was not to remove a precise amount, but rather to drain enough blood to restore balance. In practice, this often meant weakening the patient to the point of collapse. Leeches were especially popular. These small, worm-like creatures were applied to the skin, where they attached themselves and drank blood until they were full. Medieval doctors believed leeches could selectively remove bad blood. In reality, they simply drained whatever blood they could access. Some patients had dozens of leeches attached at once. In severe cases, bloodletting was repeated multiple times in a single illness. Even when the patient was already dangerously weak, bloodletting was not limited to obvious illnesses. It was also prescribed for insomnia, anxiety, and even excessive sexual desire. If someone complained of restlessness at night, doctors might conclude that too much blood was stimulating the mind. The cure was to reduce blood volume and calm the body. Many patients likely slept afterward, not because they were healed, but because they were exhausted from blood loss. Another deeply rooted medieval cure involved purging the body through vomiting and diarrhea. If illness was caused by corrupted humors, then forcing those humors out was considered logical. Doctors prescribed strong laxatives made from toxic plants, minerals, and animal bile. These substances were designed to violently empty the stomach and bowels. The suffering this caused was seen as proof that the treatment was working. One commonly used purgative was hellebore, a plant known even then to be dangerous. In small doses, it caused vomiting and diarrhea. In slightly larger doses, it could cause seizures, heart failure, or death. Despite this, hellebore was used to treat everything from mental illness to chronic pain. Patients who survived the treatment were declared cured. Those who died were assumed to have been beyond saving. Cupping therapy was another strange but widely accepted practice. Heated cups were placed on the skin to create suction. Doctors believed this drew harmful substances out of the body. In some cases, the skin was cut before the cup was applied, allowing blood to pool inside the vessel. This method combined bloodletting with suction, multiplying its dangers. Bruising, infection, and severe pain were common, but the practice continued for centuries. Medieval doctors also believed strongly in sympathetic cures, the idea that treating an object connected to the patient could heal the patient themselves. One infamous example was the weapon salve. If someone was wounded by a sword or arrow, the doctor might not treat the wound directly. Instead, they treated the weapon that caused it. The blade was cleaned, oiled, and wrapped carefully, while the wound itself was left largely untouched. The belief was that the weapon and the wound were spiritually linked, and healing one would heal the other. This approach often led to severe infections. Without proper cleaning, wounds festered. Yet, when a patient recovered naturally, the weapon salve was credited. Medieval medicine rewarded coincidence and punished skepticism. Treatments that failed were rarely questioned. They were simply repeated with more intensity. Faith played a massive role in medieval healing. Prayer was not an alternative to medicine, it was medicine. Doctors often prescribed prayers, pilgrimages, and relics alongside physical treatments. If someone suffered from chronic pain or illness, they might be told to visit a shrine, touch a holy object, or sleep near the remains of a saint. These acts were believed to restore spiritual balance, which would then heal the body. Some cures blurred the line between medicine and magic. Amulets made from animal bones, stones, or written prayers were worn around the neck to ward off disease. Certain words were believed to have healing power when spoken aloud. In some cases, doctors instructed patients to recite phrases backward or write them on parchment and consume them mixed with water or wine. Astrology also shaped treatment decisions. Doctors consulted star charts before prescribing cures. Certain days were considered safer for bloodletting than others. The position of the moon could determine whether a surgery would succeed or fail. Treating the wrong body part at the wrong astrological time was believed to invite disaster. This meant patients sometimes waited days or weeks for treatment, even in emergencies. Women often suffered the most from medieval medical beliefs, and many female illnesses were blamed on the womb, which was thought to wander through the body causing chaos. This idea, known as the wandering womb theory, led to treatments that involved strong smells placed near the patient, his mouth or genitals, to lure the womb back into position. These methods were invasive, humiliating, and completely ineffective. Mental illness was treated with equal confusion and cruelty. Depression, anxiety, hallucinations, and epilepsy were often seen as signs of demonic influence or moral weakness. Treatments included exorcisms, fasting, isolation, and physical punishment. Some patients were restrained or beaten in an attempt to drive out evil spirits. Any improvement was taken as proof of success. Any worsening was blamed on the patient's lack of faith. Despite the pain these cures caused, medieval doctors genuinely believed they were helping. Their knowledge was limited, but their confidence was not. Medical authority was rarely questioned, and suffering was seen as part of the healing process. Part 4 reveals a brutal truth about medieval medicine. Many cures were worse than the diseases they aimed to treat. Yet these practices persisted for centuries, shaping medical tradition long after their effectiveness should have been doubted. The medieval world clung to balance, blood, and belief. Blood, balance, and the madness of humors in medieval medicine. Disease was not caused by bacteria, viruses, or environmental factors. It was caused by imbalance. The human body, according to ancient Greek and Roman teachings preserved by medieval scholars, was governed by 4 internal fluids known as the humors: blood, phlegm, yellow bile, and black bile. Health depended entirely on keeping these substances in perfect harmony. Too much or too little of any one humor could supposedly twist the body and mind into illness. Medieval doctors did not question this system. They built their entire medical worldview around it. Blood was considered warm and moist, associated with optimism and vitality. Phlegm was cold and moist, linked to calmness and sluggishness. Yellow bile was warm and dry, connected to anger and aggression. Black bile was cold and dry, blamed for sadness, fear, and melancholy. Every person was believed to have a natural, dominant humor that shaped their personality. If you were cheerful, you were sanguine. If you were slow and quiet, you were phlegmatic. If you were irritable, you were choleric. If you were depressed, you were melancholic. Illness, therefore, was not something you caught. It was something you became. When a patient fell sick, Medieval doctors did not search for external causes. They searched for internal excess. If someone had a fever, it meant there was too much heat, usually too much blood or yellow bile. If someone was pale or weak, it meant cold humors had taken over. The solution was never to strengthen the body. It was to remove what was believed to be wrong. And no cure embodied this belief more clearly than bloodletting. Bloodletting was the single most common medical treatment in the Middle Ages. It was used for fevers, headaches, infections, mental illness, digestive problems, and even preventative care. Doctors believed removing blood would restore balance and allow the remaining humors to settle into harmony. The more serious the illness, the more blood was removed. Some patients were drained until they fainted. Others were bled repeatedly over several days, growing weaker with each session. The practice followed strict rules. Blood could not be removed randomly. Medieval physicians consulted astrological charts to determine the correct time, day, and body part. The position of the moon mattered. The alignment of planets mattered. Cutting the wrong vein at the wrong time was believed to cause death or spiritual corruption. Some manuals even included detailed diagrams showing which veins corresponded to which organs and zodiac signs. If the illness involved the head, blood was taken from the arm or neck. If it involved the liver, blood came from the right side of the body. If the disease affected the spleen, the left side was targeted. Doctors used knives, lancets, or specialized tools to open veins. Barbers, who often doubled as surgeons, performed a procedure in public spaces. The sight of blood flowing into bowls was so common that it barely caused alarm. Leeches were also widely used. These small creatures were applied directly to the skin and allowed to attach themselves and drink blood slowly. Leeches were considered more refined than knives. They were used on delicate patients, including women and children. Some doctors believed leeches had intelligence and would draw blood only until balance was restored. In reality, they drank until they were full or removed. Bloodletting was not limited to the sick. Healthy people were bled as a seasonal ritual. Spring was considered the most dangerous time, when blood supposedly became excessive. Many people voluntarily underwent bloodletting to prevent illness. Monasteries scheduled routine bleeding days for monks. Kings and nobles kept personal physicians who regularly drained them in the name of balance. While bloodletting weakened patients, doctors often interpreted deterioration as proof that the disease was being expelled. If a patient died, it was not because too much blood had been removed. It was because the imbalance was too severe. The theory could never be wrong. Only the body could fail. Balancing the humors did not stop at blood. Diet was treated as medicine, but not in the modern sense. Foods were categorized by their qualities. Meat was considered hot and dry. Fish was cold and moist. Vegetables varied widely depending on preparation. A doctor might prescribe specific foods to counteract a patient's dominant humor. A melancholic person, associated with black bile, might be ordered to eat warming foods like roasted meat and spiced wine. A choleric patient might be given cooling foods like cucumbers and dairy. Cooking methods mattered as much as ingredients. Boiling was thought to add moisture. Roasting removed it. Spices were not added for flavor alone. They were medicine. Pepper, cinnamon, and ginger were used to heat the body and stimulate digestion. Wealthy patients consumed heavily spiced meals not just as a luxury, but as a treatment. Mental illness was also explained through humors. Depression was blamed on excess black bile. Anxiety was linked to unstable blood. Mania was attributed to overheated yellow bile. Treatments were designed to cool or warm the mind accordingly. Patients might be bled, purged, starved, or forced into rigid routines. Music, prayer, and isolation was sometimes prescribed, but rarely without physical intervention. One of the most disturbing applications of humoral theory was purging. If bloodletting failed, doctors turned to vomiting and diarrhea. Patients were given powerful laxatives made from herbs, minerals, and toxic substances. These mixtures caused violent reactions. The suffering was seen as therapeutic. The body was expelling the harmful humor. Pain was proof of progress. Some treatments combined multiple methods. A patient might be bled, then purged, then placed on a restrictive diet, all while being wrapped in heated blankets or cold cloths depending on the desired effect. Recovery, if it occurred, was credited to the doctor's wisdom. Survival, despite treatment, reinforced belief in the system. Humoral medicine also justified extreme contradictions. A fever patient might be wrapped in blankets to sweat out heat, then plunged into cold water to shock the body into balance. A weak patient might be starved to reduce phlegm. A dehydrated patient might be denied water to avoid adding moisture. Logic was secondary to tradition. Despite its cruelty, humoral theory dominated European medicine for centuries. It was taught in universities, copied into medical texts, and defended by scholars. To question it was to challenge the foundations of medical authority. Doctors were respected not for results, but for knowledge of ancient texts. Galen and Hippocrates mattered more than observation. The tragedy is that humoral medicine occasionally appeared to work. Mild illnesses often resolved on their own. When patients recovered after bloodletting or purging, the treatment was praised. When they died, the illness was blamed. The system survived because it could not be disproven within its own logic. By modern standards, many medieval cures were actively harmful. Blood loss weakened immune systems. Starvation delayed healing. Toxic substances damaged organs. Yet within the medieval worldview, these practices were rational. Disease was not something to fight. It was something to The obsession with balance shaped every aspect of medieval medicine. The human body was not seen as a machine, but as a delicate mixture constantly on the verge of collapse. Doctors believed they were guiding nature, not controlling it. In reality, they were often accelerating decline. As medicine slowly moved toward observation and experimentation centuries later, humoral theory began to crumble. But during the Middle Ages, it reigned supreme. It justified suffering, normalized pain, and turned healing into ritual. To be sick in the medieval world was to become a battlefield of fluids, drained, purged, and disciplined until either balance returned or life slipped away. In the next part, the cures grow even stranger, as medieval medicine turns from fluids to faith, charms, and rituals that blurred the line between healing and magic. Faith, fear, and the body is a battlefield in the medieval world. Medicine did not exist as a clean boundary between science and superstition. The human body was not merely flesh and blood. It was a battlefield where spiritual forces, cosmic influences, and unseen evils constantly fought for control. Disease was rarely viewed as random. It had intent, it had meaning, and very often it had moral weight. To be sick was not just unfortunate, it was suspicious. Medieval doctors believed the body was governed by balance, not biology. Health depended on harmony between the four humors: blood, phlegm, yellow bile, and black bile. Every symptom was interpreted as evidence that one of these fluids had gained too much power. Fever meant excess blood. Melancholy meant black bile had settled in the soul. Lethargy suggested phlegm had taken over the body's internal landscape. Treatment was never about curing a specific disease. It was about restoring balance by any means necessary, no matter how extreme or illogical it seemed. But humors were only part of the equation. Faith played an equally powerful role. Many illnesses were believed to be divine messages. God used sickness as punishment, warning, or spiritual correction. If a person fell ill, the first question was not what caused this, but what sin invited it. As a result, medical treatment often blended seamlessly with confession, prayer, and ritual. A physician might prescribe a poultice and a prayer with equal seriousness. Ignoring ether was considered dangerous. Fear shaped medicine as much as belief. The medieval world was filled with invisible threats. Demons, witches, evil spirits, and curses were thought to roam freely. The sudden illness could be blamed on demonic possession. Chronic pain might be the result of witchcraft. Nightmares, seizures, and mental illness were often interpreted as signs of spiritual invasion. In such cases, treatment focused on expelling the unseen enemy rather than addressing the body itself. Exorcism became a form of medical practice. Priests were called where physicians failed. Patients were restrained while holy words were shouted over them. Relics were pressed against their skin. Holy water was forced into mouths already weakened by illness. If the patient convulsed, screamed, or fainted, it was taken as proof that the treatment was working. If they died, it was assumed the demon had been too strong, or the patient is sinful. Pain was not something to be avoided. In many cases, it was encouraged. Suffering was believed to purify the soul. A treatment that hurt was often considered more effective than one that did not. Bleeding, blistering, burning, and cutting were common practices. Cauterization involved pressing heated metal against the skin to seal wounds or drive illness out through pain. The smell of burning flesh was familiar in medieval healing spaces. It was unpleasant, but it was trusted. The body was treated like a container that needed to be opened, drained, or shocked into obedience. Bloodletting remained one of the most common cures for centuries. Doctors used knives, lancets, and leeches to remove blood from patients suffering from almost any ailment. The logic was simple. If too much blood caused disease, then less blood must restore health. Patients weakened from illness were routinely bled further until they fainted. Survival was seen as proof of success. Death was blamed on the illness, not the cure. Children were not spared these treatments. Infants were bled for fevers. Toddlers were given herbal concoctions mixed with alcohol or opium to calm them. Teething pain was sometimes treated by cutting the gums with knives to release pressure. Many children did not survive these interventions. High infant mortality was accepted as a natural part of life. Grief was common, but questioning medical practice was rare. Women faced unique dangers in medieval medicine. Female bodies were considered inherently unstable. Doctors believed women were more prone to illness because of their wandering womb, a mythical organ thought to move around the body causing hysteria, suffocation, and madness. Treatments for female complaints were often invasive and humiliating. Foul-smelling substances were placed near the nose to repel the womb downward. Pleasant scents were applied near the pelvis to lure it back into place. These methods were based entirely on imagination, yet they were taught seriously in medical texts. Pregnancy and childbirth were especially dangerous. Midwives relied on tradition, prayer, and experience rather than formal medical training. Complications were common, and interventions were brutal. If labor stalled, women were shaken violently or forced to drink strange mixtures to stimulate contractions. Surgical intervention was rare and almost always fatal. When a mother died in childbirth, it was considered tragic, but expected. Medicine offered little comfort. Mental illness was among the most misunderstood conditions of all. Depression, anxiety, schizophrenia, and epilepsy were grouped together under vague labels like madness or possession. Treatment varied wildly. Some patients were isolated, others were beaten to drive out evil influences. Herbal sedatives were used inconsistently. In some cases, those suffering from mental illness were displayed publicly as warnings or entertainment. Healing was secondary to control. Despite the cruelty and ignorance, medieval doctors believed they were helping. Their actions were guided by the knowledge available to them and reinforced by centuries of tradition. Medical authority was rarely questioned. Books written by ancient scholars like Galen and Hippocrates were treated as sacred texts. Even when treatments failed repeatedly, the theory behind them remained unchallenged. Reality bent to belief, not the other way around. Hospitals existed, but they were not places of recovery as we know them today. They functioned more like shelters for the sick, the poor, and the dying. Cleanliness was minimal. Beds were shared. Infections spread easily, yet these spaces were considered charitable and holy. Caring for the sick was seen as a spiritual duty, even if the care itself often caused more harm than healing. In this world, medicine was not about extending life at all costs. It was about maintaining cosmic order, spiritual alignment, and social structure. A cure that failed was not a failure of medicine. It was a reflection of divine will. Survival was a blessing. Death was a lesson. The medieval body was fragile, sinful, and constantly under threat. Doctors did not fight disease as an enemy. They negotiated with it, punished it, or surrendered to it. Healing was not a promise. It was a gamble shaped by fear, faith, and flawed understanding. And yet, within this darkness, small seeds of progress existed. Observations were made. Patterns were noticed. Some herbal remedies did help. Experience slowly chipped away at superstition, even if it took centuries to show results. The strange cures of the Middle Ages were not just medical practices. They were windows into how people understood life, suffering, and death. To them, the body was not a machine to be repaired, but a moral and spiritual object to be corrected. In the next part, the focus will shift to the most dangerous cure of all those treatments meant to prevent disease before it ever appeared, and how fear of the future led to some of the most extreme practices in medieval medicine. Blood, balance, and blind faith in the medieval world. Illness was not simply something that happened to the body. It was something that revealed a deeper imbalance in the universe itself. Disease was thought to be the result of disrupted harmony between the body, the soul, the environment, and God. Doctors did not ask what caused an illness in the modern sense. Instead, they asked what had gone out of balance. And once that imbalance was identified, the cure often involved methods that now seem terrifying, absurd, or cruel. At the center of medieval medicine was the theory of the four humors. According to ancient Greek teachings adopted by medieval Europe, the human body was governed by IV fluids: blood, phlegm, yellow bile, and black bile. Health depended on keeping these humors in perfect balance. Too much blood made a person hot and excitable. Too much phlegm caused sluggishness. Excess yellow bile produced anger, while black bile led to sadness and melancholy. Every symptom, from a fever to a bad mood, was explained through this framework. Because of this belief, one of the most common medieval cures for almost any condition was bloodletting. If a patient had a fever, headache, infection, or even emotional distress, doctors often concluded that the body had too much blood. The solution was simple and horrifying: remove it. Bloodletting was performed using knives, sharp lancets, or leeches. The goal was not to remove a precise amount, but rather to drain enough blood to restore balance. In practice, this often meant weakening the patient to the point of collapse. Leeches were especially popular. These small, worm-like creatures were applied to the skin, where they attached themselves and drank blood until they were full. Medieval doctors believed that leeches could selectively remove bad blood. In reality, they simply drained whatever blood they could access. Some patients had dozens of leeches attached at once. In severe cases, bloodletting was repeated multiple times in a single illness, even when the patient was already dangerously weak. Bloodletting was not limited to obvious illnesses. It was also prescribed for insomnia, anxiety, and even excessive sexual desire. If someone complained of restlessness at night, doctors might conclude that too much blood was stimulating the mind. The cure was to reduce blood volume and calm the body. Many patients likely slept afterward, not because they were healed, but because they were exhausted from blood loss. Another deeply rooted medieval cure involved purging the body through vomiting and diarrhea. If illness was caused by corrupted humors, then forcing those humors out was considered logical. Doctors prescribed strong laxatives made from toxic plants, minerals, and animal byproducts. These substances were designed to violently empty the stomach and bowels. The suffering this caused was seen as proof that the treatment was working. One commonly used purgative was hellebore, a plant known even then to be dangerous. In small doses it caused vomiting and diarrhea. In slightly larger doses it could cause seizures, heart failure, or death. Despite this, hellebore was used to treat everything from mental illness to chronic pain. Patients who survived the treatment were declared cured. Those who died were assumed to have been beyond saving. Cupping therapy was another strange but widely accepted practice. Heated cups were placed on the skin to create suction. Doctors believed this drew harmful substances out of the body. In some cases, the skin was cut before the cup was applied, allowing blood to pool inside the vessel. This method combined bloodletting with suction, multiplying its dangers. Bruising, infection, and severe pain were common, but the practice continued for centuries. Medieval doctors also believed strongly in sympathetic cures, the idea that treating an object connected to the patient could heal the patient themselves. One infamous example was the weapon salve. If someone was wounded by a sword or arrow, the doctor might not treat the wound directly. Instead, they treated the weapon that caused it. The blade was cleaned, oiled, and wrapped carefully, while the wound itself was left largely untouched. The belief was that the weapon and the wound were spiritually linked, and healing one would heal the other. This approach often led to severe infections. Without proper cleaning, wounds festered. Yet when a patient recovered naturally, the weapon salve was credited. Medieval medicine rewarded coincidence and punished skepticism. Treatments that failed were rarely questioned, they were simply repeated with more intensity. Faith played a massive role in medieval healing. Prayer was not an alternative to medicine, it was medicine. Doctors often prescribed prayers, pilgrimages, and relics alongside physical treatments. If someone suffered from chronic pain or illness, they might be told to visit a shrine, touch a holy object, or sleep near the remains of a saint. These acts were believed to restore spiritual balance, which would then heal the body. Some cures blurred the line between medicine and magic. Amulets made from animal bones, stones, or written prayers were worn around the neck to ward off disease. Certain words were believed to have healing power when spoken aloud. In some cases, doctors instructed patients to recite phrases backward or write them on parchment and consume them mixed with water or wine. Astrology also shaped treatment decisions. Doctors consulted star charts before prescribing cures. Certain days were considered safer for bloodletting than others. The position of the moon could determine whether a surgery would succeed or fail. Treating the wrong body part at the wrong astrological time was believed to invite disaster. This meant patients sometimes waited days or weeks for treatment, even in emergencies. Women often suffered the most from medieval medical beliefs. Many female illnesses were blamed on the womb, which was thought to wander through the body, causing chaos. This idea, known as the wandering womb theory, led to treatments that involved strong smells placed near the patient's mouth or genitals to lure the womb back into position. These methods were invasive, humiliating, and completely ineffective. Mental illness was treated with equal confusion and cruelty. Depression, anxiety, hallucinations, and epilepsy were often seen as signs of demonic influence or moral weakness. Treatments included exorcisms, fasting, isolation, and physical punishment. Some patients were restrained or beaten in an attempt to drive out evil spirits. Any improvement was taken as proof of success. Any worsening was blamed on the patient's lack of faith. Despite the pain these cures caused, medieval doctors genuinely believed they were helping. Their knowledge was limited, but their confidence was not. Medical authority was rarely questioned, and suffering was seen as part of the healing process. If a treatment hurt, it meant it was powerful. Gentle cures were viewed with suspicion. Part 4 reveals a brutal truth about medieval medicine. Many cures were worse than the diseases they aimed to treat. Patients survived not because of treatment, but in spite of it. Yet these practices persisted for centuries, shaping medical tradition long after their effectiveness should have been doubted. The medieval world clung to balance, blood, and belief, and in doing so, it turned healing into one of the most dangerous experiences a sick person could endure. Blood, balance, and blind faith. By the late Middle Ages, medicine was no longer just about treating illness. It had become a rigid belief system, one built on authority, tradition, and fear of questioning the past. Medieval doctors were not free thinkers. They were guardians of ancient ideas, especially those inherited from Greek and Roman scholars. At the center of this medical worldview stood a concept so powerful that it shaped treatment for centuries: the theory of the four humors. According to medieval medicine, the human body was governed by four internal fluids: blood, phlegm, yellow bile, and black bile. Health depended on balance. Disease meant imbalance. Pain, fever, sadness, madness, even personality traits were blamed on one humor becoming too strong or too weak. Doctors did not ask what caused a disease, they asked which humor was misbehaving. Blood was associated with warmth, energy, and optimism. Too much blood supposedly caused fevers, headaches, and reckless behavior. Phlegm was cold and wet, linked to sluggishness and melancholy. Yellow bile represented heat and anger. Black bile was cold and dry, believed to cause depression and despair. Every symptom had to fit into this framework, whether it made sense or not. Once a doctor decided which humor was responsible, treatment followed a predictable path. The goal was not healing in the modern sense. The goal was correction. And correction almost always meant removal. Bloodletting became the most common medical procedure in medieval Europe. It was used to treat everything from headaches and fevers to plague symptoms and insomnia. Doctors believed that draining blood restored balance. The more severe the illness, the more blood was removed. Patients were cut with knives, lancets, or leeches. Veins were opened in arms, legs, and sometimes even the forehead. The practice was so widespread that barbers became medical professionals. Barber surgeons performed bloodletting alongside haircuts and shaves. The red and white barber pole still exists today, a silent reminder of blood-soaked medieval medicine. Red symbolized blood. White symbolized bandages. Leeches were especially popular. Doctors believed leeches could selectively remove bad blood. In reality, they simply drained blood until the patient became weak. Some treatments involved dozens of leeches at once. Patients often fainted. Some never recovered. Ironically, bloodletting sometimes killed the patient faster than the disease itself. Weakening an already sick body left it vulnerable to infection, shock, and organ failure. But when patients died, doctors rarely blamed the treatment. They blamed fate, God's will, or an imbalance that had simply gone too far. Diet was another tool used to control the humors. Medieval doctors prescribed foods based on their supposed qualities. Hot foods were used to counter cold humors. Cold foods were used to calm hot ones. Spices were considered heating. Dairy was considered cooling. Wine was warming and drying. Water was cold and dangerous. Patients were often forbidden from drinking water, especially during fevers. Doctors believed water weakened digestion and diluted vital fluids. Wine, even for the sick, was considered safer. Children, the elderly, and pregnant women were routinely advised to drink diluted wine instead of water. Sleep, bathing, and even emotions were regulated under humoral theory. Too much sleep was believed to increase phlegm. Too little sleep overheated the body. Bathing too often opened the pores and allowed disease to enter. Bathing too rarely trapped bad humors inside. There was no winning. Mental illness suffered particularly under this system. Depression was labeled excess black bile. Anxiety was blamed on yellow bile. Epilepsy was often called the falling sickness and attributed to demonic or humoral disturbances. Treatments included purging, bloodletting, prayer, and isolation. Compassion was rare. Control was common. Astrology also played a major role in humoral medicine. Doctors consulted star charts before performing treatments. Certain days were considered safe for bloodletting. Others were forbidden. Cutting the wrong vein on the wrong day could supposedly anger the planets and doom the patient. Medical texts included detailed diagrams showing which veins were connected to which organs and zodiac signs. A doctor might refuse to treat a patient simply because the moon was in the wrong position. To medieval minds, this was not superstition. It was science. What made humoral medicine so powerful was not its effectiveness, but its certainty. It offered answers in a chaotic world filled with disease, death, and mystery. It gave doctors authority. It gave patients explanations. And it gave society the comforting illusion that illness followed rules. Challenging the humoral system was dangerous. Medical schools taught it as unquestionable truth. Physicians who doubted it risked ridicule, loss of reputation, or accusations of heresy. Innovation was not encouraged. Repetition was rewarded. Even when treatments clearly failed, the theory survived. If a patient worsened after bloodletting, the conclusion was not that bloodletting was wrong. The conclusion was that not enough blood had been removed, or that treatment had come too late. In this way, medieval medicine became self-protecting. Evidence did not matter. Outcomes did not matter. Tradition mattered, yet cracks slowly began to form. Some healers noticed that patients treated gently survived more often. Some surgeons observed anatomy directly during battlefield injuries and executions. They saw organs that did not behave the way ancient texts described. Quiet doubts began to grow. But for most people living in the Middle Ages, medicine remained a brutal balancing act rooted in blind faith. Doctors drained blood, restricted food, denied water, and trusted stars more than symptoms. Patients submitted not because it worked, but because there was no alternative. To be sick in the medieval world was to be powerless, and to be treated was often to be tested on how much pain a human body could endure in the name of belief. The next part explores remedies that went beyond blood and balance treatments, so bizarre that even medieval doctors sometimes questioned them, yet used them anyway. Faith, fear, and the final remedies. By the late Middle Ages, medicine had reached a strange crossroads. Centuries of inherited knowledge, ancient texts, religious doctrine, superstition, and raw fear had fused into a medical worldview that was less about curing illness and more about explaining suffering. Disease was no longer just a physical problem. It was spiritual, moral, cosmic, and deeply personal. When medieval doctors failed to heal the body, they turned increasingly to the soul. And when the soul could not be fixed, they blamed the patient. Illness was widely believed to be a sign of divine displeasure. God sent sickness as punishment, as a test, or as a warning. A fever might mean pride. Paralysis could signal greed. Chronic pain was often interpreted as unresolved sin. Doctors, priests, and healers worked side by side, prescribing remedies that treated morality as much as medicine. Confession was considered as important as any potion. Prayer was often listed alongside bloodletting and herbal mixtures as a legitimate treatment. For patients who failed to recover, the assumption was simple: they had not repented enough. One of the most common treatments for serious illness was pilgrimage. If a disease resisted herbs, poultices, and bleeding, the patient might be told to travel often hundreds of miles to a shrine dedicated to a particular saint. Different saints specialized in different ailments. Saint Blaise was invoked for throat illnesses, Saint Apollonia for toothaches, Saint Roch for plague, Saint Vitus for seizures and involuntary movements. The journey itself was considered part of the cure. Pain, exhaustion, hunger, and danger were seen as purifying forces. If the patient survived the trip and returned healed, it proved the saint's power. If they died along the way, it was interpreted as God's will. Either way, the system was never wrong. At the shrines, patients touched relics, drank holy water, slept near sacred objects, and left offerings. Some scraped dust from tombs and swallowed it. Others wrapped pieces of cloth around statues, and later pressed those same cloths onto open wounds. There was no concept of infection control. Faith replaced hygiene entirely. In some cases, doctors prescribed deliberate suffering as medicine. Fasting was recommended not just for spiritual cleansing, but for physical ailments. Starving the body was believed to starve disease. Patients with fevers were denied food. Those with weakness were told to eat only bread and water. If a patient collapsed from hunger, it was seen as proof that the illness had been strong, not that the treatment was flawed. Pain itself was considered therapeutic. Suffering brought the patient closer to God. Comfort was suspicious. Pleasure was dangerous. A treatment that hurt was more trustworthy than one that felt good. This mindset allowed some of the most brutal practices to persist for centuries. One such practice was cauterization. Doctors used hot irons to burn the skin, believing that heat could drive disease out of the body. Burns were applied near infected areas or along supposed pathways of illness. The smell of burning flesh filled medieval sick rooms. The pain was unbearable, yet doctors believed that if the patient screamed, it meant the treatment was working. For mental illness, the remedies were even darker. Conditions like depression, anxiety, hallucinations, and epilepsy were rarely recognized as medical problems. There were signs of demonic influence. Treatment involved exorcism, confinement, prayer, and physical punishment. Patients were beaten, starved, chained, or subjected to prolonged religious rituals meant to force evil spirits to flee. Doctors and priests believed that demons hated discomfort. If the body suffered enough, the demon would leave. Women suffered disproportionately under this system. Female bodies were considered unstable, porous, and prone to corruption. Many conditions unique to women were misunderstood or deliberately ignored. Menstrual pain, postpartum depression, infertility, and mood disorders were often blamed on moral weakness or sexual excess. Treatments ranged from herbal suppositories to enforced chastity to forced marriage. In extreme cases, women exhibiting unusual behavior were accused of witchcraft. Medical failure transformed into criminal accusation. A woman who did not respond to treatment might be declared cursed rather than ill. Once labeled a witch, no cure was possible. Medicine ended where fear began. Even as universities expanded and medical texts circulated, progress remained slow. Doctors continued to rely on Galen's theory of the four humors: blood, phlegm, yellow bile, and black bile. Illness meant imbalance. Treatment meant removal. Bloodletting remained the dominant practice because it fit the theory perfectly. If the patient worsened, more blood was removed. There was no standardization. One doctor might bleed a patient once, another might bleed them daily. Some bled from the arm, others from the neck, behind the ears, or near the ankles. Leeches were favored because they seemed precise and controlled. Their use spread rapidly across Europe, and leech farms became profitable businesses. Patients trusted these treatments not because they worked, but because there was nothing else. In the absence of scientific testing, tradition ruled. A cure that had been used for generations was accepted as truth. Even if patients routinely died, the logic was circular: they must have been too sick to save. No treatment was ever abandoned due to failure. Failure was always blamed on the patient, their faith, or God's will. Despite this grim reality, cracks slowly began to appear. Some doctors started questioning established ideas. Autopsies, though rare and controversial, revealed that internal organs did not behave as texts claimed. Surgeons noticed that wounds healed better when cleaned. Midwives observed patterns that contradicted religious explanations. Experience began to challenge doctrine, but change was dangerous. Challenging accepted medicine meant challenging the church, universities, and centuries of authority. Many doctors chose safety over truth. It was easier to repeat known rituals than to risk being labeled a heretic. By the end of the medieval period, medicine was trapped between fear and tradition. It had accumulated knowledge but lacked method. It observed symptoms but misunderstood causes. It sought cures but resisted change. Healing was still more about belief than biology. The weird cures of medieval doctors were not born from cruelty alone. They emerged from desperation, limited knowledge, and a world terrified of the unknown. Disease was invisible. Death was constant. Explanations mattered more than results. And so medicine remained a theater of pain, prayer, and persistence. The body suffered, the soul was judged, and the cure, more often than not, was worse than the disease. When faith replaced medicine by the late Middle Ages, the line between medicine and religion had almost completely disappeared. When cures failed, when bloodletting weakened patients instead of healing them, and when poultices did nothing but smell unpleasant, medieval doctors often reached the same conclusion. The illness was not physical at all, it was spiritual. Disease, in this worldview, was not caused by bacteria or viruses, concepts that did not yet exist, but by sin, divine punishment, demonic interference, or moral failure. When the body could not be healed, the soul became the target. Doctors, priests, and healers frequently worked side by side, and sometimes they were the same person. A physician might prescribe herbs in the morning and prayers in the afternoon. If a patient did not recover, the treatment plan simply shifted from the body to the spirit. Confession, repentance, and ritual replaced observation and diagnosis. Illness became a sign that God was displeased, or that the devil had found a way in. One of the most common spiritual treatments was prayer prescribed as medicine. Patients were instructed to recite specific prayers a set number of times each day, often aligned with the canonical hours used by monks. The belief was that rhythm and repetition held power. A fever might require 40 repetitions of a psalm. A persistent cough might demand nightly prayers to a particular saint. Failure to follow the ritual correctly was believed to weaken its effectiveness, making the patient responsible for their own suffering. Saints played a central role in medieval healing. Each illness had its preferred divine specialist. Saint Apollonia was invoked for toothaches. Saint Blaise was called upon for throat diseases. Saint Roch was believed to protect against plague. Patients were advised to pray to the correct saint, as choosing the wrong one was thought to be as ineffective as using the wrong medicine. Shrines dedicated to healing saints became medieval hospitals, crowded with the sick hoping for miracles. Relics were considered especially powerful medical tools. Bones, hair, clothing, fragments or objects believed to have touched a saint were thought to carry healing energy. Patients were encouraged to touch relics, kiss them, or sleep near them. In some cases, relics were placed directly on wounds or painful body parts. The closer the contact, the stronger the cure was believed to be. Wealthy patients paid for access to famous relics, while the poor settled for local ones of questionable authenticity. Pilgrimages were another prescribed cure. Doctors and priests sometimes advised patients to travel long distances to holy sites as treatment. The journey itself was considered part of the healing process. Suffering through exhaustion, hunger, and exposure was thought to demonstrate humility and devotion. If the patient survived the journey, it was seen as proof of divine favor. If they died along the way, it was interpreted as God's will rather than medical failure. Exorcism was used as a medical treatment for conditions that could not be explained. Epilepsy, mental illness, severe depression, hallucinations, and uncontrollable behavior were often blamed on demonic possession. Doctors admitted they had no physical explanation and handed the patient over to clergy. The cure involved prayers, holy water, fasting, and commands spoken in Latin. Patients were restrained during these rituals, sometimes violently, which often worsened their condition. Fasting itself was frequently prescribed as medicine. Illness was thought to thrive in bodies that were indulgent or impure. Starving the body was believed to starve the disease. Patients were instructed to avoid meat, bread, or entire food groups for days or weeks. For already malnourished medieval peasants, this treatment could be fatal. When patients died, their deaths were blamed on weak faith rather than starvation. Holy water was used as both preventative and curative medicine. Patients drank it, washed wounds with it, or sprinkled it around their beds. Some doctors recommended mixing holy water with herbs to increase its potency. The water itself often came from shared basins or public fonts, which spread infection rather than prevented it. Still, its use continued because it symbolized spiritual cleanliness, which mattered more than physical hygiene. Written charms and prayers were also used as medical tools. Doctors wrote sacred words on parchment and instructed patients to wear them around their necks or sew them into clothing. Some charms included fragments of scripture, while others used mysterious symbols believed to confuse demons. These texts were not meant to be understood. In fact, understanding them was thought to weaken their power. Mystery itself was considered part of the cure. In many cases, illness was treated as punishment rather than misfortune. Patients were asked to examine their lives for sin. Adultery, greed, pride, and laziness were all considered possible causes of disease. Women, in particular, were blamed for their own illnesses, accused of moral weakness or sexual misconduct. Treatment involved repentance rather than relief. The goal was not always to heal the body, but to purify the soul before death. This spiritual approach to medicine offered comfort in a world with few answers. When doctors lacked tools, faith filled the gap. It provided explanations when none existed and meaning when suffering seemed random. But it also delayed progress. As long as disease was blamed on God or demons, there was little reason to study anatomy, sanitation, or contagion. By the end of the Middle Ages, cracks began to form in this belief system. Some physicians started questioning whether prayer alone could cure physical illness. Observations slowly accumulated. Patterns emerged. But for centuries, faith had been medicine, and medicine had been faith. In medieval Europe, when all else failed, healing did not come from the body at all. It came from belief. And belief, no matter how sincere, could not stop infection, mend broken organs, or reverse disease. It could only explain suffering, not cure it. This reliance on faith marked both the comfort and the tragedy of medieval medicine. It offered hope, but it also ensured that real understanding remained centuries away. Faith, fear, and the final prescription. By the late Middle Ages, medicine was no longer just a collection of strange remedies. It had become a reflection of how medieval people understood the world itself. Medicine was not merely a physical problem. It was spiritual, cosmic, emotional, and moral all at once. A cure, therefore, did not need to make sense to the body alone. It needed to make sense to God, to nature, and to society. This belief shaped the final layer of medieval medical practice, where faith, fear, and tradition blended into treatments that now seem irrational but once felt inevitable. For medieval doctors, the ultimate healer was not the physician, but divine will. A doctor's role was often to interpret suffering rather than eliminate it. Illness could be a punishment, a test, or a warning. If a cure worked, it meant God approved. If it failed, it meant the patient had not repented enough, prayed correctly, or accepted their fate. This logic protected medical authority. Failure was never proof that the treatment was wrong. It was proof that the patient was. One of the most common treatments prescribed by medieval doctors was pilgrimage. If a disease lingered too long or defied explanation, patients were advised to travel to a holy site. The journey itself was part of the cure. Walking long distances, sleeping outdoors, and enduring hardship were believed to purifying the body and soul. Shrines dedicated to saints associated with healing attracted crowds of the sick. People with paralysis dragged themselves along roads. The blind were guided by relatives. The dying were carried in carts, hoping to reach a miracle before death arrived. Doctors encouraged these journeys because they aligned perfectly with medical theory. Movement balanced the humors. Fresh air restored bodily harmony. Suffering demonstrated humility. And if the patient died on the road, it could be explained as divine will rather than medical failure. In many cases, pilgrims returned exhausted, dehydrated, and worse than before. But if even one person reported improvement, the shrine's reputation grew stronger. Prayer itself was often prescribed as medicine, not metaphorically but literally. Doctors instructed patients on specific prayers to recite at specific times. Some illnesses required prayers at dawn, others at sunset. Certain prayers had to be repeated a precise number of times, because numbers held mystical power. 7, 12, and 40 were especially popular. If a patient miscounted or skipped a day, the treatment was considered invalid. In more severe cases, confession was recommended as a medical necessity. Doctors believed unconfessed sins could block the body's ability to heal. A patient suffering from chronic pain might be told to confess sins they had forgotten, imagined, or never committed. Guilt became a symptom. Relief became a sign of forgiveness. This approach blurred the line between medicine and moral control, reinforcing the Church's influence over physical health. Fear also played a central role in medieval cures. Many treatments were designed not to heal, but to frighten the illness away. Diseases were imagined as entities that could be scared, tricked, or offended. Loud noises were used to drive sickness from the body. Bells were rung near the patient's head. Metal objects were clanged together during fevers. In some regions, patients were shouted at during seizures to shock the disease into retreat. Children, in particular, were subjected to fear-based treatments. A child suffering from night terrors or convulsions might be taken to a crossroads at midnight. There, adults would perform rituals involving fire, chanting, or symbolic threats directed at the illness. The goal was not comfort, it was intimidation. The illness had to know it was not welcome. Another common practice involves symbolic substitution. Doctors believed disease could be transferred from a person into an object or animal. Patients were instructed to whisper their illness into a piece of bread, which was then fed to a dog. Others tied strings around trees while reciting their symptoms, believing the tree would absorb the sickness. In some cases, patients slept with animals to share the illness, especially chickens or goats. If the animal died afterward, it was seen as proof that the treatment had worked. Medieval doctors also believed strongly in the power of boundaries. Illness was thought to exist in liminal spaces, between life and death, health and decay. Because of this, cures often took place at borders, doorways, windows, crossroads, and riverbanks. Patients were made to stand with one foot inside a house and one outside. Others were washed in water drawn from places where rivers met. These locations were believed to confuse disease, weakening its grip. As medieval medicine evolved, some physicians began to notice patterns. Certain treatments consistently failed. Others occasionally worked, though no one understood why. Simple practices like cleaning wounds or isolating the sick sometimes reduced death, but these observations were dangerous. Questioning traditional cures meant questioning ancient authorities, and that could lead to accusations of arrogance or heresy. Doctors who relied too heavily on observation risked being seen as disrespectful to God's design. After all, if illness came from divine will, trying to outthink it could be interpreted as rebellion. As a result, progress moved slowly. Effective practices were often justified using old theories rather than new evidence. Cleanliness was explained as balancing humors, not preventing infection. Isolation was described as protecting spiritual purity, not stopping contagion. By the end of the Middle Ages, Europe was filled with medical contradictions. Doctors carried ancient texts filled with bizarre remedies, while unknowingly practicing techniques that would later become foundational to modern medicine. Bloodletting persisted, even as some questioned its value. Herbal medicine remained popular, despite limited understanding. Faith-based cures dominated, even as science quietly waited for permission to exist. What makes medieval cures truly strange is not their ingredients or rituals, but the certainty behind them. Doctors were not experimenting. They were confident. Each treatment fit neatly into a worldview where the universe was ordered, purposeful, and deeply moral. Illness made sense in that world. The cures made sense too. To modern eyes, these practices look cruel, pointless, or absurd. But to medieval patients, they offered something powerful, meaning suffering was not random. Pain was not meaningless. Every fever, seizure, or wound had a reason. And every cure, no matter how strange, was an attempt to restore order in a chaotic world. The medieval doctor was not just a healer. He was a guide through fear, guilt, and uncertainty. His tools were rituals, symbols, and inherited wisdom. Some patients survived despite the treatments. Others died believing they had done everything required of them. In the end, medieval medicine did not fail because it was foolish. It failed because it was built on a world that no longer exists. A world where disease had intention, where suffering had purpose, and where healing required permission from forces far beyond the human body. And when that world finally began to fade, so did its cures. The end of medieval medicine. By the late Middle Ages, something subtle but irreversible had begun to change. The strange cures, the bleeding bulls, the animal organs, the prayers mixed with prescriptions, none of them vanished overnight. But cracks had formed in the medieval understanding of the human body. For centuries, illness had been explained through imbalance, divine punishment, bad air, or invisible forces. Doctors treated symptoms with rituals because rituals were all they had. Yet toward the end of the medieval period, observation slowly began to compete with tradition. This transition did not happen because medieval doctors suddenly realized they were wrong. It happened because their treatments kept failing in ways that could no longer be ignored. Bloodletting weakened patients instead of curing them. Trepanation left survivors with permanent injuries. Mercury poisoned more people than it healed. Plague remedies failed spectacularly, no matter how many fires were lit or herbs were burned. Even the most devout physicians began to notice that prayer alone did not stop infections, and that magical objects did not repair broken bodies. Universities started to change the way medicine was taught. While medieval medical schools still relied heavily on ancient texts, students were encouraged to observe patients directly. Dissections, once forbidden or rare, slowly became more accepted. When doctors finally opened human bodies, they discovered something shocking. The organs did not always match what Galen had described centuries earlier. Blood did not simply slosh around aimlessly. Anatomy was more complex, more structured, and far less mystical than medieval medicine had assumed. This realization quietly undermined hundreds of traditional cures. If disease was not caused by excess black bile, then purging patients made little sense. If illness did not enter the body through bad smells, then carrying flowers was useless. If the brain, not the heart, controlled thought and sensation, then drilling holes in skulls to release spirits became harder to justify. Knowledge began to replace symbolism, slowly and unevenly. Yet medieval cures did not disappear immediately. People trusted them because they were familiar, comforting, and backed by authority. When someone was sick, doing anything felt better than doing nothing. A doctor who prescribed leeches appeared useful. A healer who performed rituals gave patients hope. Even painful treatments reassured people that the illness was being fought. Suffering became proof that healing was underway. There was also fear. Challenging established medical beliefs meant challenging the church, universities, and centuries of tradition. Doctors who rejected accepted practices risked being labeled heretics or frauds. Many continued prescribing strange cures not because they believed in them fully, but because deviation was dangerous. Medicine, like religion, moved slowly because change threatened social order. The Black Death accelerated this transformation. The plague killed indiscriminately, sparing neither the faithful nor the educated. When prayers failed and remedies collapsed, people began to doubt. If God punished sinners with disease, why did monks die alongside criminals? If astrologers predicted illness, why did the stars remain silent? These questions planted seeds of skepticism that medicine could not ignore. Gradually, a new idea emerged. Disease might have natural causes, not supernatural ones, not moral ones, natural ones. This idea was revolutionary. It suggested that illness could be studied, measured, and understood. It meant that cures could be tested rather than inherited. It implied that suffering was not always meaningful, it was sometimes simply biological. By the time the Renaissance arrived, medieval medicine had reached its breaking point. Doctors still used leeches, still believed in humors, and still relied on ancient authorities, but their confidence had weakened. Experimentation began to matter more than tradition. Observation began to outweigh symbolism. Anatomy replaced astrology. Evidence replaced ritual. Still, the legacy of medieval cures did not vanish. Many survived in altered forms. Bloodletting persisted for centuries. Herbal remedies evolved into pharmacology. The placebo effect, patients improving because they believed in the treatment, continued to play a role in healing. Even today, traces of medieval thinking remain whenever people seek symbolic cures, miracle treatments, or explanations rooted in belief rather than evidence. Medieval medicine was not foolish by its own standards. It was logical within the limits of its knowledge. Doctors worked with the tools they had: observation without microscopes, theory without biology, faith without experimentation. Their cures seem strange now because science has changed the way humans understand the body. But without medieval failures, modern medicine would not exist. Every bad cure taught a lesson. Every ineffective treatment revealed a gap in knowledge. Every death exposed the limits of belief-based healing. Progress was built not on success, but on repeated failure. In the end, medieval medicine was not evil, stupid, or cruel by design. It was human. It was an attempt to bring order to suffering in a world without answers. The leeches, the potions, the prayers, and the rituals were all expressions of the same desire to survive, to heal, and to make sense of pain. Modern medicine stands on the ruins of these strange cures. The mistakes of medieval doctors became the foundation of scientific medicine. Their failures taught humanity what not to do, which was just as important as discovering what worked. The Middle Ages did not cure disease, but they taught the world how desperately cures were needed, and that lesson changed everything.